So our next speaker, you saw the little video about her. This is Michelle Whitlock and her beautiful almost sleeping baby Riley. And I'm just gonna let her tell her just truly miraculous story.
Hi everyone. You saw most of it on the video. What you didn't see was that at 26, I thought if I ever wanted to be a mother, I had all the time in the world. It definitely was not on my radar, and I had been newly divorced at that time, about a year, and I had just started dating somebody who lived long distance from me. And then came cervical cancer and being told I had to lose my uterus. And for me, I started with fighting for the principle that if I wanted to have a child someday, I could have a child someday. No cancer, no doctor, no one was going to tell me I couldn't do it if I wanted. I really started this journey not knowing that I wanted this sweet angel, but that I wanted a choice. And the long short version of it is after my cancer reoccurred is when I found her and I froze those embryos. And even at the time of freezing them, I wouldn't have been able to do it if my oncologist called a friend of his that was a reproductive endocrinologist. They had been in medical school together. My doctor had helped him save a patient, and he felt like he owed him. So helping me was a way to repay that other doctor. And so he gave me all the fertility drugs for free. And then I begged my grandmother, and I used my credit cards, and I froze this baby. And then again, being an average, person, I didn't know how I would afford surrogacy. So I told everybody who would listen to me that I needed a surrogate. And somebody finally said, this friend of mine who has a friend who thinks they want to be a surrogate. And I called her, and it was like love at first sight. She was amazing. I would have met her anywhere and been friends. And we worked out a deal, and we implanted 4 embryos. We got a positive pregnancy test. I was elated. And then 8 weeks later, we found out it was a sac, but no baby growing. And I was devastated. And then I wasn't going to stop. So I went back to it, and I didn't want to use an agency because of costs. So there's a site called surromomsonline.com. And I researched and researched. Oh, Alice, will you take her for a minute? So I used on surromomsonline.com, and I still did all of the things an agency would do for you with the second surrogate that I had not done with the first surrogate. So I highly recommend that. But I did an MMPI, and I did the financial and criminal background checks and all of those things. And I got really, really lucky that the average rate for a new surrogate who's never done it could be $20,000 to $25,000. She was advertising that, and as we started to talk and I learned more about her situation, she agreed to bring her fee down. So she brought it down to $15,000 base. I paid maternity, and I gave her a $2,000 food allowance, and then I was just really nice to her. If she came over, I took her out to eat. And at the time, her family, she was in nursing school, but they lived off government assistance. She had 3 kids of her own. She had married her high school sweetheart. Neither one of them had ever worked. They were borrowing money to go to school. And they really were just trying to get by with government programs. And so I just tried to be really super nice to her. And in turn, she was implanted with my last embryo of 7. And I was told that day that 1 embryo of the last 3 was no good. 1 was poor quality. And 1 was perfectly shaped cells, but implanted on day 3, it was only 4 cells. So it was very risky, but as you can see, my miracle is here. And I hope that every one of you in this room that wants a little Riley Greer gets that someday. It is the most amazing experience of my life. And Alice, I do a lot of cancer talks, and this is by far the most amazing experience, and I want to thank you. When you first started this morning, I started talking, I was practically in tears. So, I mean, at the end of the day, cancer sucks and we know it. But to find a way to give us back hope for the future and our children and our future, I mean, what an amazing organization and an amazing experience. So, thank you all.
Oh, that little girl's so precious. Thank you all so much. We're going to start a Q&A section now. And I have questions. Many of you took... I feel like I'm being really breathy into the microphone all of a sudden. Many of you submitted questions that you wanted answered, so that's what we're doing right now is we're just anticipating, making sure that we get all of them answered. And we're going to start, Corinne first. We're going to kind of back up a little bit on fertility. What's actually the definition of infertility?
Okay, so technically the definition of infertility is any couple that has been having unprotected intercourse for 12 months or more without a pregnancy. That definition is shifted a little bit for women who are over 35 with the knowledge that the prevalence of infertility increases. So for 35-year-old women and older, 6 months or more of unprotected intercourse. If you don't have a pregnancy by that point, you should seek at least some testing, evaluation to see what's going on, and possibly consider starting some fertility treatments.
So for young women who are not sexually active or do not have a partner, it's a simple blood test and a vaginal ultrasound, and they can have some kind of sense of their level of fertility.
Yeah, those tests mostly are basically to evaluate the egg supply, which is probably the most important predictor of fertility, although it's not the entire story, because there's also the issues of the plumbing, the fallopian tubes in the uterus. So for a full evaluation, you would have to have additional tests, but those other parts are not usually affected by cancer treatments or cancer itself.
Now, most of us in this room, at least I think all of us who have gone through cancer treatment, are also wondering, can I actually go through fertility preservation if I have some level of ovarian reserve? I have some eggs there. Can I go through fertility preservation now after the fact?
Yes, you definitely can, and I mean part of the our understanding of cancer treatment's impact on fertility is that potentially just the reproductive window is shortened, but that there is still a window of reproductive opportunity after treatment before menopause, and so during that window of time you can definitely go through fertility preservation treatments to freeze some eggs or embryos before you reach that time of menopause when there are not eggs left. Ideally, you would want to do it before treatment, but then can also consider it after treatment.
Now, is there a way, and Dr. Weissman, I'd like you to speak to this as well, is there a way to use hormonal stimulation through fertility preservation that protects the health of the patient if they have hormone-sensitive cancers?
Well, I think there are 2 points here, and I think the standard of care is to receive hormonal stimulation before beginning cytotoxic therapy. So that's the first point. And the data that exists, several studies from Cornell and others, suggest that the stimulation and the potential delay of treatment does not impact on survival in breast cancer. So the windows that Dr. Chung was talking about, 2 to 6 weeks, I think that those windows do not create the concern that the prognosis is impacted. Now, the second question is much more complicated, and that is, what about during the treatment in which someone, for example, after they've recovered from chemotherapy, they would be put on tamoxifen, or let's say they didn't need chemotherapy and they were on tamoxifen alone. And that's a more complex issue, because right now this is an area of some investigation about women actually being stimulated on a period of time, during a period of time when they're on anti-cancer therapy. And I think there's reasons to be encouraged about that there are short windows where the risks seem to be low, or using drugs even like tamoxifen itself as a stimulatory agent, or so using it with other hormones. So I think it's a 2-part question. The first part I think is pretty clear, not a risk. The second part is investigational, but also reason to be hopeful.
Is there any risk genetically if you're on tamoxifen and you do a round of stimulation that uses tamoxifen, because there are now stimulation protocols, because tamoxifen, letrozole act like estrogen in the body? Is there a risk to, do we know if there's a risk to egg quality by using a medication like that that actually isn't estrogen? Do we have an answer for that?
So I think that that's something that we don't know the answer to yet, but tamoxifen actually was a fertility medicine before it was a cancer medicine, so there's actually quite a bit of experience using tamoxifen in the fertility world, more for ovulation induction than for IVF, but as far as we can tell, there does not appear to be any effect on the babies born after tamoxifen. Letrozole also has been used in that setting, and so far it appears to be safe. It doesn't appear to have an effect on the babies, but I think we need to research that further to know for sure.
Okay, and we also mentioned the word ICSI a couple of times, and that's probably something that everybody needs to find. What is ICSI?
So ICSI stands for intracytoplasmic sperm injection, where a single sperm is selected out of the millions that Dr. Rothman talked about, and basically injected into the egg, and is very successful in achieving fertilization. So really, you only need a small number of sperm to actually achieve a pregnancy if we use ICSI.
Dr. Rothman, what is the average number of sperm that your donors need to have in one of their donations to actually be frozen and banked?
Well, we'd like to have a collection of 200 to 400 million sperm. And with men, the longer he abstains, the more sperm he'll ejaculate, because sperm are produced whether he ejaculates or not. But we recommend that they don't abstain more than 7 days, because sperm reach a period of maturity, and then they don't become more mature or most mature, they become less mature. So usually 200 to 400 million sperm per ejaculation after a young man abstains, 2 to 3 days.
Now, I just met a survivor 2 weeks ago who, when he froze his sperm, he only had 4,000 sperm. What are the chances that that will produce a child?
Well, actually, if there are 4,000 good sperm, they could produce 4,000 children with ICSI. ICSI only takes 1 sperm. It's interesting because when we first started storing sperm for men with, let me stand up because I'm, when we started storing sperm for men with cancer, we were storing counts that were really unacceptable as far as intrauterine insemination or even IVF. But with the advent of ICSI, we're storing any sperm. And is it Tim? Jeremiah, I'm sorry. Jeremiah, even if those sperm are not motile, they still might be viable. And there are viability studies that you could do to determine, and if they're viable, the sperm don't even have to move. They will be injected directly into the egg. And if you're going to do in vitro fertilization, ICSI, I'm not sure, is just a little bit more expensive, but it is quite successful. And I think we're reaching a point, because it's so important for an IVF lab to be competitive, that most cycles are going to ICSI, and I'm not even sure how many are, maybe share it, how many are normal IVF programs or using ICSI.
In the journey, we learned that we would have had fertility problems due to my husband anyways. He had low mobility and morphology, the shape of the sperm, and so she's an ICSI baby as well. So he had very poor results. In fact, his siblings have not been able to achieve a pregnancy. So
She's the most scientific person in the room, that little one. Dr. Weissman, we learned about chemotherapy, different types of chemotherapy used in breast cancer. In chemo, is it the same impact on men and women, or does it really depend on the exact chemotherapy? I mean, we've heard that they fall into low, medium, and high risk, but is there biologically something different between men and women, where women are more at risk for infertility than men?
Well, each agent creates a level of risks for for women, and I think that has to do with the way the drugs work on the cycle on ovarian function. So really can't comment on men in terms of whether they're the same. My guess is they are quite similar, but most of the chemotherapy agents for women in the adjuvant setting, which is the women who don't have metastatic disease but still need chemotherapy, are based on what's called alkylating agents, and those are the ones that are probably the most inducing ovarian failure. So if we had a protocol that allowed us to stay away from those drugs, used, say, adriamycin or an anthracycline alone, that drug is less likely to cause ovarian failure. But unfortunately, all our combinations are, all our drug usage are combination based, and virtually every one of them has an alkylating agent. I think this kind of group ought to stimulate research in potentially using either single agent therapies or in low risk settings where the benefits of chemotherapy are more marginal. Maybe we have to revisit the areas of adjuvant chemotherapy because of the issues of fertility.
So far we know for women, we need a blood test and we need an ultrasound, and we can either go to a fertility specialist or our OBGYN, correct? And for men, you need to provide a sperm sample through ejaculation. Can that be done, Dr. Rothman, at home and mailed in, or at home and then brought in, or does it have to be done in your masturbatorium?
It's better to have a fresh sample. So I would say within 2 hours of an ejaculation, but it doesn't have to be brought into the sperm bank. I mean, if there are people living in more distant locations, they just have to bring it into any lab, and not to be frozen, but just to be assured that there's sperm present. And then you'd have to go to a cryopreservation center, because we have to treat sperm with a cryoprotectant agent, just like they do with eggs when they freeze it. And once they're stored, they could last forever. We give them potential immortality if you put sperm in a sperm bank.
If someone has been treated with a chemotherapy agent, they do have some level of fertility, both men and women. Will that fertility continue to decline? So they should go ahead, and even though they've been through cancer treatment, should a man still go ahead and bank sperm, or is it something that damages you right when it happens and then it stays kind of level?
Sperm develop over a period of 3 months, so there are many sperm in the ejaculate that are mature. And even if the man has chemotherapy, the sperm that he's ejaculating for about a month might be fine. They're mature sperm, they're not dividing, so therefore they're less affected. Also, alkylating agents are as damaging to sperm as they are for eggs. We usually recommend that a man wait 6 months to a year after chemotherapy, because there could be a residual effect on sperm. Some people would say longer, but I'd say at least six months to a year would be good to wait.
And how long should a woman wait, particularly if she's also on some kind of long-term therapy like tamoxifen? How long should she wait to get pregnant or try?
So after chemotherapy, if you're not on tamoxifen, it's thought that you should wait about 6 months before getting tested, because again, the ovaries kind of shut down during chemotherapy, and it may take some time before everything is kind of working again in a way that you can test accurately. If you're on tamoxifen, tamoxifen is a hormonal agent that can potentially impact some of the results that we would get from hormone testing and maybe even the ultrasound. So generally, while you're on tamoxifen is not really the time to have your FSH level or antral follicle tested. Wait until you're done with the tamoxifen.
Dr. Weissman, is there a risk for any cancer patient, regardless of breast cancer diagnosis or any other leukemia, lymphomas, skin cancer even, is there a risk to their health if they get pregnant and carry their own baby?
Well, the data, although not comprehensive, does not suggest that pregnancy and breast cancer increases recurrence risk. In fact, there is some data that says after 2 years it's even more favorable to become pregnant. So I think that that's a myth and probably worthy of describing as a non-issue. Now, the one thing though, and I will say this to a patient, is the major risk of recurrence is early after the diagnosis of breast cancer. So let's say a patient has 15 positive lymph nodes and gets chemotherapy. They have frankly, a recurrence risk independent of the pregnancy that's in that first 3 to 5 years. And I do think there is some responsibility. This is a major emotional journey to discuss with the woman. If you get pregnant and then you get a recurrence, how are you going to feel about having a child and you're dealing with metastatic disease? And that's not a conversation that is easy to have, and I think that needs to be had in patients, particularly the highest risk group, where the issue is not the pregnancy, the issue is the recurrence.
Thank you. Do women successfully who have a recurrence while pregnant, are they able to go through chemotherapy while pregnant and deliver a healthy child? Anyone?
Just repeat that.
Women who are facing a recurrence while pregnant, are they able to go through chemotherapy again and deliver a healthy child?
Well, recurrence during pregnancy, so let's talk about pregnancy and breast cancer briefly. Organogenesis is basically the first trimester, and that's when organs are developing embryologically, and virtually all chemotherapy is not considered safe during that period of time. And that's about 12 weeks, something like that. After that, second trimester, third trimester, we feel pretty comfortable with most chemotherapy not impacting on the health of the child. So there are other complex issues Dr. Chung can address, but we do give chemotherapy routinely for breast cancer in second and third trimester without concern. Now the other issue of recurrence, that's a very complex discussion. That means delaying treatment in a patient with metastatic disease, etc. So that's a very complex issue.
As they all tend to be, don't they? This is for the entire medical panel. What is the first step or phone call that one should make when they do want to start a family? Is it their oncologist? Is it their primary care physician? Is it a fertility specialist, their OBGYN?
It's only recently, Alice, and basically because of people like yourself, that the knowledge is even getting out there. For about 25 years, we've attempted in vain to inform oncologists, oncology nurses to consider fertility, and very rarely did they. They basically thought that your life is at risk and therefore we're going to try and save your life, and the rest of it was not very important. Now I could say there's an incredible interest internationally. As you know, you're speaking in December about preserving fertility, realizing quality of life is very important, not just in quotes life itself, but the ability to achieve what one wanted to during their life, and having babies is a very high priority.
Thank you. Lisa, you've bravely chosen a sperm donor, then a surrogate, and now you're embarking on choosing an egg donor. What can you share with us about your decision-making process?
Which part?
For all of it. How do you actually start the process of whittling down hundreds and possibly even thousands in certain situations, potential donors or surrogates?
It can certainly be very overwhelming, to pick who is going to be either the sperm donor or the egg donor. But it's a lot like online dating, which I had a lot of experience with. But I mean, in truth, it really is just about being really clear about what are your non-negotiables and what are the things you're willing to give on. And so you just make a list of criteria, and you just filter your results. I mean, I'm a management consultant, and I approach the process like a management consultant with a spreadsheet and criteria, and and I ultimately, when I was choosing a sperm donor, kind of found my way to a sperm donor that I felt really great about. And I am just about to embark on the process of selecting an egg donor, and will take a very similar approach. Although I will say, with an egg donor, a lot of people don't know this, but you can meet and interview your egg donor. So whereas a sperm donor, it's frozen at a bank, for egg donation, it's not an egg bank. You're actually picking a woman who will go through the process to produce eggs for you. So it's a real person that you have to trust will go through this, process the way they should. And but you do have the opportunity in many cases to actually get a really close look at this person. So it's a very interesting process, but there's absolutely a way to do it. Do you have a question? Yeah.
This is all new to me, this part of it.
Yeah.
Would you ever consider somebody that you know?
Oh, good question. I mean, it's complicated, right? So and do you mean for egg donor or sperm donor? Egg donor.
Can you do that for, I guess you could do it for sperm donor.
Absolutely.
Okay, but for
Absolutely.
egg donor, since you're meeting them anyway.
Right. Right. I think that certainly you can consider someone that you know, but you would have to really take into account what that means and what kind of relationship there might be. What kind of relationship does that donor want? What kind of relationship do you want? What do you tell your child? It's just, it's more complicated, and I just would say to people to just think about all of those different aspects before they make a decision. I don't think there's one right answer. It's just making sure that you really think it through. But you can do that, certainly.
Lisa?
Yes.
I just spoke with Andrea, and apparently, I'm glad Pamela's here now. The donor that you chose we found out after a while, he's an SMA carrier.
Right, and I'm not, so it's okay.
Okay, so if Pamela would be okay, that donor is available at no charge.
Oh, really?
He's probably restricted. We'd have to make sure we still have him.
That's amazing. It's like hitting the lottery, though. I mean, thank you. That's amazing.
That's very sweet.
As far as I know, and Pamela could confirm it, there's really no risk to the offspring.
As long as the egg donor doesn't test positive for it. And there's a 10% chance. Okay.
Okay, so actually, Pamela Calum, can you come up for just a second? Okay, well, I can come to you if you'd like, because this does bring up a really good question in some of the Q&A, which is talking about genetics. And there is something called PGD, which is pre-implantation genetic diagnosis. And we do have our genetic counselor here. And I don't think anybody in the room besides maybe 4 people know what SMA really means. So what is it that you're testing when it comes to genetics of, what would you test for both sperm donor, egg donor, and what should you be looking for?
SMA?
Well, let's start with SMA, just define what that is so nobody's like, what the heck are they talking about?
Okay, SMA it's a genetic condition. It's called spinal muscular atrophy, and it's a new genetic test that's now available to the general population just in the last couple of years. So we started testing our donors for it a couple of years ago. And if we had known about the donor being a positive carrier for a genetic mutation for this disorder, we wouldn't have taken him into our program, but we tested him after he was already in our program when the testing had become available. For this particular genetic condition, both parents have to have a genetic mutation for it, for their children to be at risk of actually being affected with the disorder. If Lisa also carried the mutation, she could actually test her embryos by what Alice was calling PGD. It's a process of fertilizing the egg and actually having an embryo, removing one cell from that embryo and doing the genetic testing on the embryo. So you can identify that this embryo will be a child with SMA, this other embryo will not. So you can determine the risk to your future children if you know that there's a genetic risk in advance, which is one of the concerns for even if you are choosing an egg donor or using a sperm donor and your own eggs. You also need to know about your own medical history because you've been through cancer, you've gone through fertility preservation, but you still have the same other genetic risks as anybody else who's planning a pregnancy that you might want to think about and consider through a genetic consultation when you are planning that pregnancy.
Pamela, are they routinely checking egg donors for SMA now?
The genetic testing of egg donors is different. In the United States, most sperm banks take the responsibility for doing the genetic testing on the sperm donors that we provide. For egg donors, it's very different. Because there is the individual selection of an egg donor, it would typically be Lisa's own physician who said, oh, you should do this genetic testing on your egg donor. So every egg donor in the United States has different genetic testing. we actually just did a study on that, and it's highly variable. Sometimes it's the egg donor facility who decides. In most cases, it's the actual recipient's physician who decides what testing they think is appropriate. So it's very variable, and I would say most egg donors do not have SMA testing. Most couples who conceive naturally don't have SMA testing until they're already pregnant, if they have the testing at all.
And we actually have some resources for egg donors here that we'll get them to weigh into that discussion in just a minute. But when it comes to PGD and the fact that you can actually do genetic testing on your embryos, what else can PGD test for? And what is the average cost in the country for PGD?
I don't know the average cost currently. There are different types of PGD. PGD can test for one individual mutation. So if a woman knows that she has breast cancer due to a BRCA mutation, you can actually test which embryos inherit that mutation if you don't want to pass it on to your child. But that's one, it's like a single spelling mistake in the DNA of the embryo. You can also look at the chromosomes, the large structures carrying your DNA, in that single cell from the embryo as well. And a lot of laboratories that do PGD can now do both tests for you, because the chromosomes are very pertinent to study based on a woman's age. They're very important. That's the same thing that an amniocentesis is testing for later on. So there are a lot of different genetic tests that can be done by PGD.
One more question for you. Does PGD, is there a risk to the embryo by taking that one cell out?
There's always a risk to the embryo, but the technology's been around about 20 years now. There's a lot of children who've been born from PGD, but there is a chance that you will damage the entire embryo by removing a cell from it, and that's where you want to carefully select an IVF practice and know your reproductive endocrinologist's experience, and I'm sure the physicians can tell you more.
Okay, very good. Actually, let's take this discussion back over here. There are two representatives here from Peas in a Pod, which is an egg donation agency. And can you give us some insight? You're based in California, but you are nationwide. What kind of testing do you do for your egg donors? And most importantly, what would you recommend that we look for when we are selecting an agency?
Well, I think the first thing, oh, sorry. Hi, I'm Tracy. Well, we don't do genetic testing. Like she said, a lot of the when you choose a donor, if she's a first-time donor, the doctor's facility that the couple is working with will do most of her testing. We have a panel of specialists that will review when we have a donor apply with us. We have a panel that will review her information, go over her medical background, ask questions, interview her on the phone. So it's more of a question and answer type application. There are certain questions that are asked of her and FDA guideline questions that the donor would have to answer to be able to be accepted into the program. And then also the knowledge that the donor has to know what her commitment is to the actual egg donation. I mean, the donors need to know that they are committing to a lot of doctor's appointments. They are committing to shots, not pills, for the medications. Basically their time and effort spent for this couple, knowing that they're giving this gift to this couple. So there's a few other different little questions that we'll look over before she's actually accepted. So there's a few different steps that way.
Does an egg donor ever remain in the family's life?
We have had several cases where there's a few donors who have been asked by the couples. Most of our donors apply with us assuming they're going to be completely anonymous, and that is their information is put on there, their private information is kept private, their profile is put on our site, and you're able to see 5 pictures, whether it's current pictures, baby pictures. They'll fill out an application of all of their characteristics, their education, and then that profile is put on there once they're accepted as an anonymous donor. Then if a couple comes to us and says, you know, would the donor be interested in meeting, whether it's in person or it's over the phone or maybe a Skype. We've done all 3. We've had donors who didn't know that that was an option, and when we've approached them, they've been open, very open to it, because it's given them another link to what they've been able to help them with. And a lot of times it's not a relationship to have in the future, it's just to get to know the person who's going to be giving them this gift. And I think it's also to kind of give them a sense of they are who they say they are, and giving them that comfort of knowing this profile that they're reading on paper, it's the real person that they're getting to. So some are open, some are completely wanting to remain anonymous because they feel like they want to do this for the couple, but that's where it lies, and so they won't. It just depends. Yeah.
Gail Sexton from the Donor Source, and my question, Donor Concierge. Donor Concierge. So my question is, what is the primary motivation actually of these egg donors and these surrogates that you come into contact with your kind of clients?
Well, first, I don't have an agency. What I do is I help couples to find, quite often, hard to find donors. So if many of the couples I work with have advanced degrees and they want someone who's very bright, and so they can't go to any one agency and find someone. So I am actually have a network of agencies that I work with, including Peas in the Pod, about 60 agencies across the country. So I help them find people that they would consider that they can relate to, basically. But their motivation, usually most young women are going to initially probably respond because it's a way that they can pay off their student loans, but most young women, I'd say, have to have more of an altruistic desire to help people than, because it's an invasive process. And so I'd say it really does take a combination of both. And I think for surrogates, quite often, it's something that, for them, it's a way that, something that's easy for them. They've been able to have children of their own, and so it's something that they can do, and it's an amazing gift that they can give to someone else who can't carry a child themselves.
Hey, Alice, I think for surrogates also a lot of times it's that they, at least in my experience with the two I had, is that they love to be pregnant. They love the way they feel when they're pregnant. They feel most beautiful when they're pregnant. It's the attention they receive when they're pregnant, and they either have, like my second surrogate had 3 children and her husband didn't want more children, so it was a way for her to continue that feeling and not have the baby responsibility. And the second one just loved it, the pregnancy, but she was a single mom, and so there was no way she wanted to change diapers. And so I think that's another piece of why they do it.
Meeting the donor, Eddie and Kim, maybe they'll tell you a little bit insight on their thoughts.
I'm Kim, and this is my husband, Eddie Estrada. I'm coming up on a 5-year survivor. I was stage 3 breast cancer with 20 positive nodes, hormone positive, BRCA2. I had TAC, everything. And we just recently started our journey on surrogacy, and we're going through Peas in a Pod. And initially when you go on a donor site, the first thing you think of is online dating. I met my husband on Match. So you become, you have to make your list of what you want. And when you find that, you just know. Like when you're meeting your significant other, you just know. You look at that person and you think, wow, she has characteristics, she has the same type of lips as I do, or she has this or that, or she has certain sports photos that symbolize what you're all about and what you want your child to be all about. And initially I struggled with meeting the donor because that's a really hard concept to come into. But I thought down the road I want to be able to say that I've met her and I can say, wow, you have this characteristic of her that I saw when I met her. And so we set up a meeting, and obviously we have to see if the donor is okay with meeting us. And we met her, and it was fabulous to sit across the table from somebody that wants to help you so much in making your dreams come true. And so just explaining to her what was important to us and learning about her, like, what do you do in your spare time? Or where did you grow up? Or what are the mannerisms that you have when you're nervous? So that you can write those down and to be able to, when we have a child, to be able to share that and be open about it.
So many more questions. Jeremiah, I want to move back to you, actually. And you were so young when you were first diagnosed. At what point in your cancer journey did you meet Amy? And then how did you approach the conversation about your missing anatomy and your potential infertility problems, challenges.
Sure. I met Amy in August 2008. I was a sophomore, starting my junior year at BYU, and she was starting her sophomore year. And we dated for a good while. I think, I don't actually remember the exact day I told you. I can tell you my feelings. I wasn't worried about it, to be honest. And maybe that's probably more reflective of my personality than anything. I just figured it is what it is. There's nothing I can do about it, and we're going to do our best, and I was really optimistic. I actually only had a 30% chance of being infertile. I just happened to be in that unlucky 30%. And so I was like, I'm fine. I'll be fine. You know, don't worry about it. But
which is totally his personality.
Which is
like,
my personality.
I was like, no, you're not going to be fine. And this
So I told her really early on, I think, and just like, yeah, you know, here's what happened. There's a good chance I'll be infertile, but I'll be just fine. You know, so she could probably tell her side.
I don't know. We were just, I remember we were driving home from a date, I think it was Sundance, and it was like her wedding reception or something, and I knew he'd had cancer, and so I was like, so what exactly happened? Like, what kind of treatment did you get? And found out that he did have the orchiectomy and all that stuff, and it was actually pretty early on. But I still wasn't even sure if we were going to keep dating, and so I was like, okay. And then as we started to date more, actually, like you mentioned, he comes from a family of 11. He only has 2 older brothers, lots of sisters, and his 2 brothers actually, all of their children have come from IVF. So when I learned that, I knew that even if he wasn't in that 30% from his cancer, the chances of us being okay were very slim. And I mean, they've been able to have, one brother has 4 children and the other has 2, which is, you know, incredible. But and we found out like his sperm issues were actually very different than his brothers. He had a regular count, but low motility, whereas his brothers had very, very low counts, like 7 or something, really low. But so I was prepared and knew that eventually it was coming along. And I think too, I kind of was like, okay, it'll work itself out. We'll figure it out when the time comes. Thinking it'll be very long down the road, and then it's here right now. So we don't know, but it actually wasn't too bad.
How would you recommend, or let me ask this question first, with people who are just kind of newly dating, at what point in that newly dating cycle do you recommend that someone approach the conversation?
My opinion is if you had cancer, it's probably something that's going to come up fairly early in your relationship. And so, like us, it came up as a natural part of a conversation that you would expect to have with someone in the early stages of a relationship. And cancer is such a significant event that it's hard to avoid that conversation. So it came up very naturally, and I believe, you know, I don't know the answer to that question. I think it's a very personal thing. Amy and we talked about family very early on. We had very clear ideas about what kind of family we wanted to have, whether it was with one another or not, and how many children we wanted to have. And so the idea of talking about kids and the ability to have kids was a very, very natural conversation. It wasn't a forced conversation. It wasn't difficult. And so for our relationship, that was very open, and we knew what we wanted to do in terms of our families. It was natural and okay to have it very early on and to be very frank and clear about it, which we were. For those that may not be as open or very clear about what their goals are with their family and what their partner's goals are with their family, that could be something that should be approached probably more delicately or delayed later on in the relationship. But for us, it wasn't that way.
Lisa, is it different for you?
Yes. I mean, look, I'm in my 40s, and you know, that idea of talking about fertility with your dates is just kind of going to happen. But I mean, I have a second date tonight, and he knows I've had cancer, but I haven't told him that I'm planning to have a baby with a sperm donor and a surrogate, and it's happening now. And want to have a third date? You know, it's it's awkward, but I do think it just naturally comes out, and I probably will need to tell him maybe before the 4th date. I don't have the answer. I'm sorry.
And Lisa, entering single motherhood, what kind of support system do you realistically need to pursue that route?
I mean, for me, and not related to cancer at all, I think a live-in nanny is how I'm going to handle being a single mother, which is actually cheaper than a full-time nanny. People don't know that. So that's my plan.
Oh, I think I might have just finished all your questions.
Does anybody in the audience have any questions?
All right, let's get into actually funding. So everybody has asked us at one point, how expensive is this, and how do I actually go about funding it? So we're going to give a few people a chance to answer that question. We know that the average cost of IVF alone, in vitro fertilization, is about $14,000 in the state of California, recently published information. And we've also mentioned that we do have a network of fertility doctors that will work with you on the IVF fees at a reduced cost. But let's talk about surrogacy, and we do have some representatives here on the surrogacy side that can discuss what is the range that people can expect if they're going to go the route that that Lisa is going.
For our specific agency, it's about between 15.
Introduce yourself.
I'm sorry, I'm Donna with the donor source. For our specific agency, it's somewhere between 15 and 100,000. Now, that's a low singleton first-time transfer, successful singleton pregnancy, no time, lost wages, nothing like that will be the low end of around 50,000. Multiples, multiple transfers, multiple carrying multiples, complications, you could talk, get closer to that 100,000 mark.
And Donna, whoa, everybody awake? Donna, do you mind actually just coming to the front so we can get you on with the microphone? Because another question is, regarding these fees, what are the fees for, and does insurance cover, in the state of California, does insurance cover any of the medical fees associated with the surrogate's pregnancy?
For our agency specifically, the agency fee that you pay to the agency to arrange everything is around $19,500. You have somewhere between $3,000 and $4,000 for legal costs, and then first-time surrogates are $24,000, and then they get certain things along the way. I'm sorry, I'm the egg donor expert, not the surrogate expert, but they get certain things. So if they're carrying multiples, they get a certain fee. If they have to reduce, they get a certain fee. So it kind of all goes together. If there's bed rest, they get a certain amount of lost wages for that. If they need childcare because of that bed rest, they get a percentage of that. So that's why it could go anywhere from 50 up to 100. Insurance is a very, very tricky thing. Some insurances cover surrogacy, some do not, so you need to really talk to the person. Do not trust your agency. You want to see an insurance card. You want to make sure that somebody calls and verifies what the coverage is, because they will tell you, yep, they're covered, and then you're going to find out there's an exclusion for it. You're going to get billed back for it. Everybody, it used to be Champus that through the military was, oh yeah, you have military coverage, just know, of course you're covered. That's starting to be complicated. This is coming to be on a lot more radars across the U.S. now, so you really need to check with the insurance and find out.
I was going to say, we paid for, since I didn't use an agency, so I was just trying to save that roughly $20,000, we paid for a lawyer for ourselves, and we paid for a separate lawyer for our surrogate. And we had the lawyer review her insurance. And with the first insurance, because it was through her work, it paid for some of the IVF stuff, but it wouldn't have paid for anything else. And the second surrogate took out a Blue Cross Blue Shield policy in the state of Tennessee, not California, so just to clarify that. And where we don't have a lot of surrogacy laws, we're sort of a gray state. We're not for or against. And so for us, it was easy that it was like a universal thing. So even though she wasn't covered for maternity when she got pregnant, because they don't bill till the end when she delivered, it did cover the majority, I mean, as if I had been pregnant, and so we saved some costs that way.
And this is kind of a unique situation because we have, someone who found a surrogate independently, and then we have agencies in the room. So, Christy, do you want to speak to, how do you know what is the right choice for you? How should people go about choosing whether to go through a surrogate or a private surrogate or an agency?
I'm Christy Montgomery. I run surrogate parenting services. We've been in business for 21 years. So back when I started doing surrogacy, there were doctors and lawyers that wouldn't even touch surrogacy. But fortunately today it's a much more viable option than it was in the past. I think you do have to be careful finding a surrogate independent. There are people out there that that are online that you have to be careful with. So I kind of say, well, once your child was here, would you choose who you want to leave your child with over the internet or something like that? You know, so you really have to be careful if you're going online. I think meeting somebody maybe through a friend or something like that where you have an idea of who this person is, that's a big difference. And if you go with an agency, they're going to do criminal background checks. They're going to do psychological testing. We do a home study. I go to every surrogate's home and interview the surrogate and her husband in their home, so I can see how they live, how they interact with their children. The psychological report you'll get is 3 to 5 pages long. It's not a one-line she passed. So yes, you do pay for agencies, but there's an awful lot that they do for you. But if it certainly can work if you find the right person, but I just say be really careful.
No, and I agree 100%. You get to be very careful. And I probably would not have gone to self-selection, because my second surrogate I found online. Had I not, I have 19 years as a management executive. I interview, hire, fire people for a living. And so interviewing a surrogate, and I still did an MMPI and a full psychological profile, and paid for those things. But had I not had that background, I don't know that I would have taken that route myself.
And a lot of questions people also have has to do with adoption. But before we get there, I do actually want to find out from a couple people just funding options. Dr. Acasio, Brian Acasio is in the room from Acasio Fertility in Laguna. We have Dr. Chung and we have Lisa and we have, we have a number of patients in the room who are going through this. So how do you see patients pay for things like surrogacy? Is it something, because I'll tell you for me, sometimes it feels like it's something that's only available for the wealthy, and for people who aren't wealthy, how do we actually make this dream come true? So who would like to actually start with the first answer? How do you fund this?
Again, my name is Eddie Estrada. So with Kim and I, in order to fund this, which we're in the middle of it right now, and our cost is about $100,000, if not more, and that's where we stand right now. When Kim and I decided to get married, we were going to do a registry fund at Macy's or at some other store. And when we really looked back at it and thought about, is that those new set of pots and pans or this or that really going to be so useful, we decided to get rid of your traditional registry, and we went with a road to surrogacy registry. So everyone who came to our wedding, if they wanted to contribute or give us a gift, all their money went to our road to surrogacy. And so we were able to raise some money, but not the entire amount. So for us, we're funding it through refinancing a house and taking some money out of our house, doing partially a loan, and then also doing some of our own money as well. And we have to do egg donor, we have a surrogacy agency, a lawyer, we have the fertility clinic and so forth, so there's a lot of pieces here. But for us, we had to get creative in how do you come up with that money. And so that's our way of funding it. So,
Lisa, what about you? This is going to be your second.
Yeah, no, it's going to, by the time this is over, it's going to be like $125,000, and so it's coming out of my savings and retirement, and I'm just saving a lot more now, a lot fewer dinners out. But I happen to be very fortunate that I have the financial resources to go this route. But I'm very interested in how people that don't have this option.
Eventually, we'll be able to give scholarships from Fertile Action. Dr. Chung and Dr. Acasio, how do you see people financing it through your offices?
Well, I think think that a lot of couples have to be creative. It's just a lot of money, but you know, I think the discounts that centers like ours and Dr. Ocasio's provide helps a little bit, but then there are also financing programs available for fertility services where you can make payments, or, you know, just like you're buying a house, you know, make monthly payments as opposed to lump sum, and I think that's the way a lot of our patients end up going. Right.
Brian, what about you? Do you see anything creative or innovative?
Family members, you know, if you have friends that are willing to be a surrogate, that certainly saves quite a bit of money. Family members that are willing to bring their sisters who are egg donors for their sisters.
A lot of parents step in and they help out and give a little loan or gift. And then combined with the discount, I talked to John Jones from different offices, if it gets the cost down, can at least allow for the couple to try.
That's Lisa Ocasio, Brian's wife, by the way.
We also partner with pharmaceutical companies to try to get them to donate medications, and they've been very forthcoming as far as helping, especially in these cases.
Sorry, one other thing I wanted to add was when you talk about creativity, my wife and I came up with this idea that we have to be advocates for ourselves. So we actually built our own website and tried to have it promoted. We were fortunate enough to be selected for a TV show for our wedding, and that, I think, kind of stimulated the idea of promoting this for yourself. So we created our own website, and you'd be amazed, people around the country who would donate and really be there for other people. And we've found that out, and that was really exciting to see how many people out there really want to contribute to such a cause. So.
I'm curious, was your journey part of your being selected for the TV show? Your story, was that part of it?
Yeah, it was. With my wife, her history of breast cancer, and when we wrote into the show, they really liked the story behind it, and realized that our dream of having a family would really contribute to the story of putting the show together, and we think that's one of the main reasons why they selected us. Other than she's so beautiful and I'm not, but that's why we think they selected us. The show was My Fair Wedding. It's a show that the wedding designer comes in 3 weeks before your wedding, looks at what you have for your wedding, and then throws it all away and redesigns your wedding within 3 weeks. So, yeah, the host for the show decided to help promote our website, which helped with a lot of the attention to the website and some of the donations as well. The host is David Tatera. The show's on the WE Network, Women's Entertainment, and he's world famous. He's very famous for doing a lot of famous movie star weddings and so forth. And so the show's now on YouTube.
What's your website?
Our website is it's called www.ourroadtosurrogacy.com, and you can read about the show and our background and everything that happened.
And see her gorgeous wedding dress.
Just a historical perspective about surrogacy. In 1975, anybody here heard of Bill Handel? Okay, do you know what Bill Handel started with? Okay, well, I'll go back even before that. Bill Handel is a very well-known radio commentator, somewhat controversial. But he was a contractor. He went to law school, wasn't doing that well. He was a contractor, and he messed up on a house of a Dr. William Carew that cost Dr. Carew money, but Bill didn't have it. So Dr. Carew said, well, I'll tell you what, you're a lawyer. I want to do a surrogacy program. So I met Bill about 1975, 76, before he was on the radio, and he was doing surrogacies. At that time, we didn't have IVF. So a surrogate would charge $5,000 to be a surrogate as well as an egg donor. So all I did was the insemination. And just to see the way things have changed in the last 30 years, it's just amazing. And he'll talk about it on this program. Or if anybody wants to just call up and tell him, Cappy said you used to be a contractor.
And by the way, there's probably only one Cappy in the whole world. Yes, Dr. Weisman.
I think in the medical oncology world, I said earlier, I don't think we're doing a very good job. And hearing all this kind of courageous, you know, stuff on the part of the patient, $100,000, and the last thing you want is a doctor who's kind of tepid and timid and say, why are you doing that? I don't think it's a good idea. If your doctor doesn't know the literature and doesn't really have a sound understanding of the fact that you deserve this, that you can do this, and that the risks justify doing it, that person is, in my experience, do a lot of second opinion work. Women come in and say, well, my doctor didn't really encourage this, or he said I might be taking risk, or those are the things you don't want to hear. So I think that you need your doctor to be very supportive, because if you're putting up $50,000 to $100,000, the last thing you want is someone who's casting doubt and anxious and feeling that they're going to, you're going to feel abandoned and they're not going to be there for you. And I have two ladies with metastatic disease, both of whom adopted children 8 years ago, now living with metastatic disease, and those children are now 8, 9. One was adopted through, she could only get a child through Kazakhstan, went to Kazakhstan, adopted a 10-year-old, that 10-year-old is now graduating high school and going to Yale, okay? So, you know, there's all kinds of things that are happening, and I think you have to be really there in that collaborative dialogue with your physician, because if you're going to spend that kind of money, you don't want someone who's not knowledgeable.
That's wonderful, and that was a perfect segue into the adoption conversation.
I just wanted to say, is if you do it over, I mean, depending on what your thing is, because it was a 10-year period from when I was diagnosed to when Riley was born. So by being able to pay for my part of harvesting the eggs up front, and then saving, where we were able to save roughly $40,000, and then working with the doctors and the surrogate to try to work down their costs. And then in the end, we did, I think it's through Capital One, they have a fertility loan. We borrowed the last $10,000.
And we will collect all those fertility financing resources for you and put them on our website. Thank you for adding that. So it's not that you have to have $100,000 tomorrow, is I think the bottom line is what we're talking about. There's phasing here. You don't just find an egg donor, a sperm donor, and a surrogate in one day. Nor do you find a husband in a day. As Lisa and I both know. We're still on the hunt. But let's talk about adoption. When I first started this organization, one of the things that was very daunting is that I learned very quickly there were only 5 public adoption agencies that were cancer-friendly. Why does that matter? It matters because the public agencies are the most affordable, and they're domestic. And so that meant, okay, yet another cost-prohibitive parenting option for cancer survivors is adoption. Now, we've compiled a list of resources for you that is, we put in the Fertile Action brochure for you. And some of the, and this, let me just tell you, this information is not readily available, which is why we expanded our website to include this. This took lots of research just to compile 1 page of resources with a few different volunteers of ours. The adoption agencies that will work with cancer survivors are listed here below. Some of them are religious-based organizations and will only select, for instance, a Christian couple. So that's something for you to be considering too. The one that I saw actually mentioned the most on an adoption and cancer Yahoo group, which is a fabulous group we list on here for you, is actually Adoption Associates. They were just mentioned the most. I can't speak to any kind of validation behind why they were mentioned the most. It's just that there seems to be a lot of activity with them finding children for cancer survivors. The other thing to note, and we did include Kazakhstan on our list of cancer-friendly countries. Now, some countries right now, like Russia and China, will consider a cancer survivor for an international child, but right now they seem to be only placing special needs children. Not going to speak to that because I'll get angry. Colombia, Ethiopia. Ethiopia, kind of again like Adoption Associates, seems to be the most talked about right now. And these things tend to ebb and flow and morph over time. But Ethiopia seems to be very cancer friendly right now. There's a lot of really beautiful children and pictures that I've seen actually posted on this Yahoo group for adoption after cancer. Some of these as well will consider single women. So that's another thing, that if you are going to pursue single parenthood like Lisa is right now, that's important to note as well. Some of the agencies also require you to be 5+ years out. Most of the ones that we put on our list, though, and the countries will consider you if you are less than 5 years out. And in countries like Russia, it's kind of completely up to the judge and not necessarily an agency. But most of the agencies we listed, especially Adoption Associates, Holt International, they will actually help you with the international adoption process as well. So if you're kind of considering, well, what are the requirements and what's a good first step for me if I want to adopt, all you have to do is log onto their website and start poking around and just pick up the phone and call them. They're really wonderful on the phone. There is one place that we found that is offering adoption grants called helpusadopt.org. That specifically does grants to cancer survivors. Now, what we've seen out there is that it's very limited funding, so we can't promise that it's going to be able to cover everybody. There is also something for embryo adoption, and that is kind of a burgeoning area because you have all of these infertile couples that have leftover embryos, and I think that, and correct me if I'm wrong, Dr. Casio and Dr. Chung and Dr. Rothman, that I believe that it's about 5% of couples that have frozen embryos still banked that are done with their family planning that are willing to donate them. That was the latest. Is that accurate? About 5%? I would think so too, just the last published data I saw. But that is an option, and in some cases it's considered donation, in some cases it's considered adoption, and just like in adoption, you can do an open adoption where you have some kind of participation of the person who is providing you with the embryo or the child. They can have some kind of impact in the child's life. I mean, you exchange photos throughout life. They're not a routine part, but they are in the child's life at some level. So we included that information below. And actually, Rich Vaughn, I'd like you to come up for just a minute so I can ask you a couple of questions. And then we're going to wrap it up. But International Fertility Law Group, Rich Vaughn stopped by today to support us here because a lawyer, you need a lawyer for just about every part of this complicated nature. Yeah, exactly. But what I describe about Rich is that, compassionate and attorney doesn't usually go in the same sentence, but it does with Rich. And, this is something he focuses exclusively on third-party reproductive law in general. And so I wanted to hear from your perspective, if you want to go the private adoption route and not use an adoption agency at all, what is involved in that? Is that something that you would get involved in?
Well, my firm focuses only on assisted reproduction, so if you do need some adoption assistance, you should speak to some adoption attorneys. I have resources. If anybody wants to contact me, I can certainly point you in the right direction for that. But in terms of any assisted reproduction, if you're using an egg donor, you need an egg donation contract. With sperm donation, you don't necessarily need it. There are 35 states in the country that have sperm donation statutes, which would basically say the sperm donor is not going to be a parent as long as you're doing it through a licensed IVF physician or a bank. But you do need a contract with an egg donor. In some sperm donor situations, if it's a known sperm donor, you may want to consider doing a contract, and that's what we do. You also need a contract with your surrogate to explain all the parameters of the arrangement, and of course express the intentions of the parties that the surrogate and her husband, if she's married, will not be a parent, do not want to be a parent, do not want to be involved. And then you also need to go, in most states, you need to go to court to rebut the presumption of law that the person carrying the baby is the mother. You have to go into court and basically present the situation to the judge. And it's an agreed situation, it's not a contentious thing. And in some states, you don't even need to go yourself. The attorneys can go and do the hearing for you. But as a result of that court hearing, you get a court order that says that you are the legal parents. The surrogate is not. Your names will go on the birth certificate. That's a short version.
Which can be a little daunting, but
Yeah.
you know, in this day and age where people can go online and get all kinds of contracts and so forth for free, can you just discuss why
Sure.
that's probably a bad idea in this scenario?
I've had several clients come to my office saying, hey, I found this contract online, and I look at it and it's missing a lot. This is a very specialized area of the law. You need to know that your contract is specifically addressing everything that the judge is going to want to see, and that the parental rights in particular are addressed with a lot of degree of specificity. So, yeah.
Thank you so much.
Sure.
Did we miss any questions that you might have? Okay, good. Then I'm actually just going to move to some gratitude. I can't believe that we started so late and we're only really 15 minutes over. We will get kicked out of the room at, I believe, 5:30. And so that does give us a good 35 minutes for you to interact directly with our panelists and with our resources in the room. And some of the people that we asked some questions of directly have kind of what we call our showcase in the back, where you can pick up additional resources. We gave you a fancy little Fertile Action bag so that you can put those resources in your bag and tote that around, so that we're promoting the very notion of we are here to empower you to take action, whether that's simply by empowering you with education and coming here today, or if that's helping you navigate the process. We can connect you to peer-to-peer support about this very topic if you want to talk to somebody privately, anonymously, over the phone. We have partnered with an organization called Immerman Angels so that we're able to create our own network of fertility angels, and we will make sure that you get the peer support that you need. I would like to just offer my absolute deepest gratitude to Dr. Rothman and Dr. Chung and Dr. Weissman, Lisa, the Jukes, I love your last name, Michelle for flying herself and Riley all the way from Memphis to come and talk to us today, for all the showcase that Peas in a Pod and Donor Source, Surrogacy Source, Donor Concierge, for Acasio Fertility being here and for helping us put this on, for International Fertility Law with Rich Vaughn, and for Surrogate Parenting Services as well. You guys are absolutely amazing, and you've given us an infrastructure so that we're able to stand on this platform and deliver our mission to cancer survivors. And you know, everything starts grassroots and everything starts local, and I think it takes an incredible amount of courage for survivors to come to a room like this where you know very few people, you don't know me, you don't know the panelists, and to come in here and just by that first step of acknowledging, I need this information, I'm concerned about this. It used to be a very private conversation. We want to take this public, we want to raise awareness. And I promise you that Fertile Action will not stop until we actualize our mission that every single cancer survivor who wants to become a parent gets to. So thank you so much for being part of this, and just know that I am 100% committed to you, or to your children, and we're just going to have all kinds of Fertile Action babies in our future. Thank you for being